The prevalence of cancer at both national and global levels remain on the rise, with Uganda registering 34,008 new cases in 2020, of which 22,992 succumbed to the monster. These figures could be brought down if all Ugandans stood up for the completion of the radiotherapy bunker facilities at Nsambya Hospital, which helps in reducing the recurrence of cancer.
For some types of cancers, radiation will come after having your surgery and having your chemotherapy, just to reduce the rates of recurrence of that cancer. For example, breast cancer in its early stages is treated first with surgery, then with chemotherapy, then you can have radiation.
The equipment we're talking about is about 5.2 billion, one machine. That is bringing it and fitting it. We want 2 machines. The machine has to be fit exactly, and there are technicians that have to make sure the machine is precise.
Cancer care is one of the most expensive treatments and requires a collective effort, as explained by Rotarian Dr. Andrew Sechitoliko.
Take us about a 3.5 million for me to just say you have this type of cancer with that. I've not yet determined how I'm going to treat it. And let me tell you the most modern way to treat cancer. Once I know what it is, I do what we call gene typing on it. I see what type of genetic mapping it looks like. I also do some chemistry tests to see which drugs it will best respond to. So care for cancer already can hit a 10 million before we start touching. So the advocacy, guys, doesn't stop in building. We are doing a lot. The government is listening.
Once fully installed, the radiotherapy bunkers will ease on the overwhelming numbers of cancer patients at Mulago Hospital.
In Mulago, I don't say it's a bad hospital, it's good. They are doing their best, but they're overwhelmed. They are overwhelmed. You go to a doctor and all of us are waiting for one doctor. The doctor has to see you have prostate, you have breast. It was too much.
Will break down every other time. So you have an appointment with the doctor, you go to Mulago, the doctor is there, the machine is down. You go back. Cancer is such a bad thing that hits you hardest. It hits your pocket, it hits your health.
The Rotary Cancer Run is not only intended to give hope to cancer patients, but also as a platform to remind everyone about the importance of early screening. It should be remembered that early screening of any disease increases one's chances of survival.
It's all of us putting on our socks, working extremely harder than we have ever worked. Why? Because now we know what is required.
If I didn't use force to my wife, I think that should be normal. So we need to men here, let us ensure that we support these ladies. Let us use force to take them and check every.
According to the Uganda Cancer Institute, the most common cancers eating up Ugandans include breast cancer, cervical cancer, prostate cancer, Kaposi sarcoma, and the cancer of the ovary. Mary Namkose.